What's up, y'all? This week 4. And once again, it's Dr. J and
Dr. K.
And we're back to give you another reaction and review to week 4 of HBO's In Treatment. Last but not least, and this one will be a really quick recap because it's only a couple of things. We see the demise of Rita and Brooke's relationship. Last week, I was wondering, would that relationship sort of bring them back into becoming drinking buddies? Or, would that lead to Rita, losing her sobriety in an effort to keep the relationship? And we see just the angst and the pain that Rita has really coming to Brooke's house, who requested that she comes 4 a.m. to watch a lunar eclipse. But in that, she becomes her caregiver. She gets rid of the alcohol because apparently Brooke has went on another bender again. She doesn't even want to get out the bed. She finally, gets the coffee and all of that. And she's like, wow, I am reliving what it is like to overcome alcoholism. And it's triggering. And then when she's talking to Brooke, she's like, this relationship triggers me. And before I lose myself, I just have to meet you when you're ready to be on the sober side. Then we see her quickly retreat to Adam, and she pushed Rita away. And then, she talks with Adam, and then in a sense, the conversation that they have, Adam wants something meaningful. It's really kind of strange because she kind of looks at Adam as he's her form of escapism, but he looks at her as you make me think deeply. So they both are getting what each other are missing out of one another. But I always tell people all the time, relationships cannot complete you. You have to be whole within yourself. It's not, hey, well, she's serious and I'm fun, so opposites attract. Oftentimes, it really kind of bring out the demons that both of you have. And then, lastly, Brooke decides to make the wise decision to have sex with Adam unprotected.
The wise decision?
Yeah, I'm saying wise decision in her crazy mind. No, it's not wise at all, but in her crazy mind. Because remember, when she's talking to Layla, she says sometimes when people are having sex, they go outside of their mind. She's out of her mind and just saying, hey, I'm just going to let whatever happens. Kind of like her alcoholism and or just being reckless. So, what's your thoughts about Brooke? What's going on?
She's not in her sober mind. I mean, and it's the alcohol. It's the alcohol talking. It's the alcohol thinking. The alcohol making decisions. And it's sad because God forbid she actually gets pregnant. I still don't trust this guy. So I don't know if he's really in it for the long haul. Like, why is he there? I thought he lived in Philly. So I'm still confused about where and how he enters anyway. But she's unraveling. And then you see her with this fake phone call to
Paul.
Your boy, to Paul. Knowing that he's on a video, he's on a show. Like, I'm going to call right now because I know he's live and he won't answer the call. Like, she's evading. Like, it's too much. And they're still trying to manipulate Rita. I need you. And it's too much. She's lost herself. And she cannot be effective for her clients when she's that lost for herself. I don't care what anybody says. You can't be, because there's so many elements of each one that are triggering, that resonate with her. The idea of not having a voice like Lila. This, whatever, I don't even know what this is with Colin. But
anger.
Yeah, anger. Deceit. I don't know, but she's not in her right mind.
And don't forget,
take some time.
The mothering of Elijah.
Well, yeah, that's clear. That's very clear. So yeah, she needs help and she doesn't see it. And to keep going back to, and then for her to mock Rita with Colin, and then she said, "I'm taking hostages." It's like, as you're drunk, like, come on, like she doesn't see herself.
Oh, with Adam, yeah.
With Adam, she doesn't see herself, but that's the nature of substance abuse, substance use disorders, that you don't see yourself. You see your immediate needs, what you think will help, what relieves for the moment, but she's down the spiral, man. She's down the spiral, and she's out there.
You know what? But before we leave the show, it's one thing that we always know, that when we talk about addicts and when we talk about addiction, it's never about the addiction. It's always the other things.
Mm-hmm.
So I would probably say it has, the alcohol is a symptom, but the real cause of her issue is her father is dead. She doesn't have that connection with her child. She's probably been putting that off and just living off the anger against her father. She is looking at legacy and what will she leave behind.
Mm-hmm.
And, I think this is just a case of a therapist maybe struggling with midlife crisis.
Could be. It could be. I think it's elements of that and just unresolved issues from the past, because she's been in rehab before.
Right.
We heard that in this episode. She's been lost for some time, but she puts the Band-Aids on that Rhonda and the dad want Lila to put on. And at a certain point, the Band-Aids just don't work for deep wounds. So,
well, you guys have it. We'll be hitting you guys up with week 5. Oh, quick announcement. I think you guys already know, on HBO Max, we know that they have dropped all the episodes and that sort of thing at one time. However, in the spirit of what we're doing, step-by-step analysis, we're just going to continue to go by week. So next week, we'll be covering week 5, and we'll just do that and I think it's a total of only 6 weeks left. So we'll just do week 5, and then we'll come back and do week 6, and then we'll try to find another show with a Black therapist. So remember, only 4% of therapists are African Americans. So with that being said, this is Dr. J with a review of In Treatment with my wife and psychologist, Dr.
K.
And we'll hit you next time. Peace. We'll see you. We'll save room for you on the couch next time with no alcohol.